mental health. I'm not used to this. Mental Health and Addiction Crisis Center. My name is Jenny Schoening, and I am excited to be a part of today's event, both as a mother of 2 sons living with severe mental illness, and as a member of the Crisis Center Task Force, representing the voice of family members. As a member of the planning group, I listened to community leaders who expressed the tremendous need for mental health and addiction services. Again and again, we heard that access and stigma kept people from receiving care. One faith leader we interviewed estimated that nearly 70% of the people he served had an issue with mental health. And in a mental health crisis, unlike a physical health crisis, the hospital emergency room is not an ideal environment for healing. The first time my son was in crisis, nearly 15 years ago, and at 17 years old, we were told to go to the hospital emergency room. He was manic, delusional, and in extreme distress. My husband and I were anxious and exhausted. We spent more than 24 hours in a chaotic emergency department, waiting for a place to go for psychiatric care. And finally, he was admitted. After a week-long stay, we left that first hospitalization with little more than a pamphlet on his diagnosis and a 6-week wait for a psychiatrist. In the years that followed, our family would have many more experiences with minimal care and multiple readmissions. Today, I am so thrilled that individuals and their families coming to this center will have a totally different experience. They will be welcomed by mental health professionals and peers in a home-like, safe, and comforting space. They will receive patient-centered care that goes beyond the crisis itself, care that includes pharmacy, medical, family, and community services. And most important, they will build relationships to make the center a trusted resource. That's a game-changing approach for my family and for other families across Franklin County. And I want to thank everybody for making this happen. And now I'd like to introduce the CEO of the Adam H. Board of Franklin County, Erica Clark-Jones.
Oh, good afternoon. Jenny, thank you so much for sharing your family's experiences with us today. Your experience and that of many others underscores the commitment to services that will be provided in the new Franklin County Crisis Care Facility. For those joining us online and for those here in the audience, thank you. Thank you for being here to not only mark this occasion that has been a long time in the making, but we are here because of you, because of your partnership, your investment, and your interest. As a community, Columbus and Franklin County has been challenged to do more and to do better for individuals and families in crisis. Thanks in part to the Franklin County taxpayers who approved a modest levy increase in 2020, your Adam H. Board of Franklin County and partners are working every day to enhance the crisis care continuum in Franklin County. So how do we define the crisis care continuum? Pardon me. We define it as someone to call, someone to come, and somewhere to go. Someone to call. With the support of the federal and state government, 988, the new National Behavioral Health Crisis Hotline, was launched last summer, and it is answered by local partners 24 hours a day, 7 days a week. As far as someone to come, this includes community-based mobile response teams staffed by local clinicians and certified peers to come when a law enforcement response may not be necessary. And the somewhere to go is the new Franklin County Crisis Care Center. Once opened, this 72,000 square foot community-based facility will serve up to 80 individuals at any point in time and offer critical crisis intervention services, including walk-in and inpatient units. meeting a range of needs through an innovative model that integrates recovery, clinical, and medical services together to provide comprehensive, person-centered care. We anticipate the center to open in spring 2025. The availability of equitable and accessible care, regardless of insurance status and ability to pay, is essential and non-negotiable. With many of you, Adam H. started planning for the new Crisis Care Center several years ago, and that work was influenced by several realities, including 20% of Franklin County's residents will experience a mental illness in a given year, with a forecasted growth in demand for services of 23% over the next 10 years. In 2019 alone, Franklin County experienced nearly 30,000 adult behavioral health crisis episodes. Because the need was great then, and it continues to be urgent, it underscores the need for continued collaboration, innovative thinking, and leadership, which you all have demonstrated. It has taken so many people and so many teams for many months and many years coming together to make this commitment to accessible care a reality. And I have to name a few. The many volunteers representing the voices of public safety and community-based behavioral health providers who served, like Jenny, on planning committees and work groups. The individuals and families with lived experience who provided invaluable input on what this crisis care center needs to be. All of our public sector partners, all 3 Franklin County commissioners, and our county administrator, Kenneth Wilson, the City of Columbus, Mayor Andrew Ginther, and the City Council, led by President Shannon Hardin, the State of Ohio, including the Governor's Office, the Legislature, and the Ohio Department of Mental Health Addiction Services, led by our friend Lori Criss, the Ohio Congressional Delegation from both parties, past and present, including Representative Beatty, Senator Brown, Senator Portman, and we can't wait to work with Senator Vance. None of this would be possible without our private sector partners. And that includes the Central Ohio Hospital Council and the indefatigable Jeff Klingler, and the adult serving hospital systems, including Ohio Health, OSU Wexner Medical Center in Mount Carmel, and the many philanthropic donors led early by Terry Donlin Huseman and the Osteopathic Heritage Foundations, nationwide AEP and CareSource Foundations, the PEGS Foundation that has provided technical assistance every step of the way, and the many private partners listed in your program. And I cannot and will not let this moment pass without recognizing the incredible work of the Adam H. team, led by Jonathan Thomas, our Chief Operating Officer of Franklin County Adam H. And I'd like to thank my bosses, my inspiration, the Adam H. trustees, for your leadership then and your leadership now. Please stand so that we can recognize you. I once had this advice given to me. They said, if you want to accomplish something fast, go alone. But if you want to go far, go together with invested partners. Collaboration is the robust engine that has helped advance this important project. It's yet another example of the storied Columbus way. This energy, this collaboration, and this concern for our fellow man and woman will power this center and provide help, health, healing, and hope to those living with and occasionally struggling with mental health and addiction-related crises. I am so pleased today that Governor Mike DeWine was able to join us. The governor is a longtime advocate for mental health and addiction issues. He understands that investments in mental health and addiction only make our state and our community stronger and healthier so that everyone can thrive. We are grateful for his presence. Please join me in welcoming Governor Mike DeWine.
Erica, thank you very much. With this groundbreaking today, we take one more step forward as a state to fulfilling a commitment that was made 60 years ago when John Kennedy signed the Community Mental Health Act. And sadly, we did not live up to what we promised at that time. and that was that every family who is experiencing a problem in regard to mental health, you have a loved one, that you would not have a wait, that you would be served in your own local community without a wait, and that there would be help for you there. I think what is really significant and to me exciting about today is that so many different people are responsible for this, and so many different organizations. Truly a public-private partnership. The city, the county, state, federal government, and our hospitals coming together to be a real part of this. And I think that, you know, and of course the Adam H. Board, we cannot forget them, they're the key. But I think what it means is that there is becoming, and I'm seeing this in Ohio, more and more a recognition that we have to deal with behavioral health, and we have to give people help. And we have to, again, fulfill the commitment that was made 60 years ago. And I can just see it as I move around the state and this community. People get it. So this is really an unprecedented coming together of so many different groups, so many different people, public-private partnership. Can't wait to come back here, Mayor, when we come back here and look at the building. And we can't wait till the day it is open and serving the people of Franklin County and the state of Ohio. Thank you all very much. Let me introduce Scott Doran, Chairman of the Adam H. Board of Trustees. Scott, thank you very, very much for all that you do and all the board does. Thank you.
Governor, we can't wait to have you come back for the grand opening rather than the groundbreaking. And thank you for being here. It's an honor and a once-in-a-lifetime opportunity to be part of the development of the Franklin County Crisis Center. It's really emblematic of the commitment of the Central Ohio community, businesses, government, and individuals that Adam H. was able to boldly move forward to establish this innovative one-stop crisis center. We went all in. We committed to do things differently and better. And it was accomplished with lots and lots of community support and incredible effort from Adam H. staff and our partners. The Crisis Center will be life-changing in the delivery of care for those experiencing a mental health or addiction-related crisis. Through our evaluation of crisis facilities in other communities, we recognized that it was vitally important to create a different way forward and do it in a way that ensured the dignity of the individuals and the families who will rely on the center for years to come. I want to reiterate Adam H.'s gratitude to all who participated in the comprehensive public and private planning for the center, and of course for the extraordinary and generous funding. What sets this facility apart is that it was planned and designed by the community and for the community. We would not be where we are today without community-wide input and investment. The fact that local, state, and federal governments have come together to commit substantial financial resources for the construction of the Crisis Center demonstrates the need for these services and validates the community-based solution. So thank you all for being here to celebrate this opportunity with us. In addition to Governor DeWine being here for this milestone event, we are grateful for the many leaders and their staff that have joined us today. Franklin County Commissioners John O'Grady, Erica Crawley, and Kevin Boyce. City of Columbus Mayor Andrew J. Ginther. Columbus City Council President Shannon G. Hardin. Council Member Mitch Brown. State Senator Herschel Craig. State Representative Dontavius Gerals. Franklin County Administrator Ken Wilson, Ohio Department of Mental Health and Addiction Services Director Lori Chris, Franklin County Health Commissioner Joe Mazzola, Columbus Public Health Assistant Commissioner Edward Johnson. And thank you to the hardworking staff who have joined us from the offices of U.S. Senator Sherrod Brown, Governor Mike DeWine, Congresswoman Joyce Beatty, and State Senator Herschel Craig. We would also like to acknowledge the proclamation sponsored by Senator Craig for today's Crisis Center groundbreaking event. We now would like to welcome to the podium Commissioner John O'Grady, President of the Franklin County Board of Commissioners.
Well, hello, everybody, and thank you. On behalf of my colleague, Kevin Boyce and Erica Crowley, it's a pleasure to be with you guys here today, as this crisis center has been a long time in the works and will be a tremendous benefit to the families in our community. As most of you know, roughly 1 in 5 Americans has a mental health emergency in any given year, and 1 in 10 abuses or is dependent on drugs or alcohol. In a county our size, that's hundreds of thousands of residents who are in need of services and family that are hurting and may not know where to turn. As things stand today, our community is struggling to serve these citizens in need. Law enforcement personnel may be dispatched to deal with somebody who isn't breaking the law, but who also isn't able to come to care for themselves, or may even be in danger to somebody else. Hospital emergency departments often become the provider of last resort, but at great cost and with limited resources and very limited ability to follow a patient after they've been released. And of course, many people in mental health crisis or with substance abuse disorders end up in a criminal justice system that is ill-equipped to serve them at all. This piecemeal approach is perhaps the most expensive and least effective way to help somebody in crisis, and is inadequate both for patients and for our community. That's why this crisis center is such an important step forward. It's going to be a part of a community-wide system of care. It represents an investment in mental health and addiction resources and in the families that need them. It also is a commitment to support our first responders and hospital systems that are currently shouldering the load of mental health crisis. And it's a community safety initiative and a smart justice initiative that will help keep people in crisis from going to jail. This crisis center is an investment in Franklin County families and in the bright future of our community, and it's an honor to be a part of it with you here today. Now it's my pleasure to introduce my good friend and colleague, Mayor Andrew Ginther.
Thank you, Commissioner, and good afternoon. What a great day here in the city of Columbus. Governor, we're thrilled to have you with us. I don't know about you, but I think we have the best Adam H. Director in all of Ohio, and Erica Clark Jones. Her board and team are absolutely fabulous, and this is a great way for our community to move forward together. I don't know about you, but I don't think there's ever been a greater need for mental health and behavioral health services in our community. We're coming out of the pandemic, the isolation, the disconnection, the depression. There has never been a greater need for this crisis center. Time is of the essence, and the people of this community and communities around our state are counting on us. This is another great way, as has been mentioned, one of the pilots that we continue to expand at the City of Columbus is the Right Response. It's our alternative crisis response system. Our neighbors who are battling addiction and in mental health crisis do not belong in jail or ERs. They belong in treatment and support and help. And this crisis center will help us do that. We continue to expand the Right Response. We need our law enforcement professionals to be helping us prevent and reduce violent crime. They can't be all things to all people. And we need to invest and support our mental health professionals, our public health professionals, our addiction specialists to help our neighbors in their time of crisis. And that's exactly what this crisis center will do for us. Continue to move us forward, better serve our neighbors, and make our community safer and healthier in the future. We couldn't do this alone. Mayors can propose whatever they want, but we don't appropriate at the local level. Our council does, and we have a huge champion in this crisis center, our alternative crisis response, and our city moving forward. Please welcome Council President Shannon Harding.
Well, good afternoon. As the mayor said, this is an amazing day in our city, only to be eclipsed by that warm spring day in 2025 when we open the doors for the services here. But thank you all for being here. To our governor, I echo the mayor's sentiment. Let's give it up one more time for Erica Clark Jones and her amazing leadership. To Scott Dorns, to Jonathan Thomas, to, again, the mayor, to Commissioner O'Grady, to my friend Kevin Boyce, and to, is he our deja vu council member Mitch Brown, who has come back again to serve with us. Thank you so much for being here. This is a historic investment for our community. As elected officials, public safety is our top priority. In recent years, we have been challenged to reimagine what public safety looks like for our community. And when folks are in crisis, when they are grappling with trauma, we must lead with compassion. This center serves as the physical embodiment of that goal. Trained specialists, doctors, nurses, social workers, a team focused on being there for those in need. All the moment, at the moment of their greatest need. We're talking about people who may be our neighbors, our family members, our friends. These teams will have the resources, public support, and perhaps most importantly, access to world-class treatments right here in Columbus, and that should be celebrated. These teams will give hope, sometimes in a person's moment of greatest need. This center represents our commitment to meeting critical challenges head on. We started to answer mental health crisis with new teams, mental health clinicians, and social workers, allowing officers to focus on preventing and solving violent crimes. But there wasn't always a great destination for those struggling with mental health. This will change that for the Columbus community. Not just in the opening of a building, but in building something life-changing, a comprehensive crisis response strategy that meets all of our residents' needs. And I'm proud to be joined today in that work by our next speaker, Ms. Lori Cross, who's the director of the Ohio Department of Medical Health and Addiction Services. Welcome to the stage, Ms. Lori.
Good afternoon, everyone. Thank you so much for inviting me here to be part of this exciting day and for welcoming me into partnership with you. Our department is so grateful to stand in service to the work of local communities around the state. I want to pause for a minute and reflect on the time that Governor DeWine and I sat down and talked about the opportunity to serve in his administration. And we talked a lot about what our Department of Mental Health and Addiction Services would do to help every Ohioan live up to their full God-given potential. And one of the things we talked about was making help more visible, more accessible, and more effective for families throughout the state so that they could have a healthier, more hopeful look into the future when they were struggling with mental health and addiction issues. And so I was grateful to say yes to that call, and I'm grateful to be able to be here today, not just as a funding partner in this work, but as a true partner on a day-to-day basis with the ADAM board, with boards across the state, with CEO Erica, and with the opportunity to continue serving together. Erica talked about the 4 pillars of the crisis work, and we have that at the state as well. Connect, which is 988 and the opportunity for people to call somewhere safe. Respond, and the mobile crisis opportunities to meet people's needs wherever they are in the community, at home, a library, wherever that might be. Stabilize, somewhere safe and welcoming to go, where you're understood and you don't have to tell your story in a way that people might not understand. That's what we're celebrating today. But I want to just talk a minute about Thrive. This is a 4th pillar that we Ohioans believe in and are lifting up differently than any other state in the nation. We want people to be in crisis once, maybe, and maybe never again, because they got what they needed here at the center, and then they got connected to services and supports that will help them with lifelong recovery. And that includes not just that treatment that they may need, medication, counseling, other services, but housing and recovery supports and peer services and all of the things that any one of us needs to live our best lives. And so we're dedicated to continuing this relationship with not just the board and the providers here, but with all of you locally to truly lift up this vision and to help put the resources and services in place that will help every Central Ohioan, every Ohioan live a healthy, hopeful life. So congratulations, Erica, everyone here. And now I'll introduce my friend who is the leader and CEO of the Central Ohio Hospital Council, Jeff Klingler.
Thank you, Director, very much. And Erica, after we're done, I'm going to Google indefatigable. So we're going to, that's a new one. I'm going to take it as a compliment. But I want to thank you all for being here today on behalf of our hospital systems. This is a great day, Mayor. We're very excited to be here. It has been a journey. And my role today is really to talk about how did we get here? We've been working together as a community for many, many years now. And I'm fortunate in my position with the Hospital Council that I've been around a while. And I've actually been part of this community conversation really since day one. So I hope to share with you a little bit about how we got here. I can tell you again, the journey's been long, but it's also been extremely rewarding. And I think it's really a great example about how a number of organizations can come together and try to solve a common problem, perhaps from different perspectives, but we all working together to solve something that we know is very important to our community. So going back to 2015, we came together as a community to address this important issue. Our goal at the time, and still continues to be today, how do we best serve our patients and our residents who are in or nearing a psychiatric crisis? To give you some background about how our hospitals got so involved in this work, let me give you a little bit of background, taking you back 13 years ago. In May of 2009, many of you are familiar with an initiative that we went live with called the Franklin County Bed Board. It is a project where we work with a number of providers trying to get patients who are presenting in an emergency department into the care that they need when they're in psychiatric crisis. I bring up the bed board because in May of 2009, it was a very big issue at that time, and we had 400 patients that month in our EDs in need of inpatient psychiatric care. 3 years later, we topped 800 patients. 2 years later, we topped 1,000 patients. 3 years after that, we were nearing 1,500 patients. So we knew as a hospital community that we needed to do better. So it was at that time the hospitals reached out to our partners at the ADAM board, to our partners with OMOS and others in the community and said, what can we do here locally to help improve this system? So we know, as Jenny said, that hospital emergency departments, they're not the optimal setting, right, for providing psychiatric care. They're loud, they're busy, they're bright. And we knew that we needed to develop a better system to really better care for our patients and our residents. So it was that year in 2015 that we formed a task force, and we invited about 30-plus organizations to come together. Many of you are in the room on that PCES task force. And we worked together for a couple of years to identify better ways to meet the mental health needs of our residents. And on that task force, we had representatives from hospitals, from EMS, from police, city, county, and state government, treatment providers, payers, and most importantly, patients and families. So for that next year, we worked to identify what can we do in this community, and the number one recommendation was to build this center. And I can tell you again, I can go back and remember those days. We had 30-plus organizations come together, and those 30-plus organizations had 30-plus ideas about what a crisis center needed to do and what it should do to meet the community. But I will say it was really fascinating. We continued to meet, we continued to talk to each other, we continued to listen to each other, we continued to learn from each other. And over time, we took those 30-plus ideas and we really came together with a common goal. And I'm just really excited because that common goal is what we're breaking ground on today. It's really been very extremely rewarding to me, both personally and professionally, to work side by side with so many community organizations, each bringing their own ideas about what we need to address such a complex problem. But seeing those individual ideas come together with a common vision And being there to break ground on this work today, it really is a highlight of my career of working with hospitals for 30 plus years. So like for many of you here today that were involved in that work, today's emotional. It's emotional in a good way, but it's emotional. We've worked very hard together side by side. When we do come back 2 years for the ribbon cutting, I know the Crisis Center will be a success. And it will be a success because we were inclusive and we did learn and listen to each other in developing the plan. So again, I want to thank all the partners involved in this work for sticking to it and getting us to where we are today. So again, thank you for just giving me a few minutes, and I'm happy to turn it over to also my friend, Terry Donlin Huseman, President and CEO of the Osteopathic Heritage Foundations.
Thank you, Jeff. Let me get myself situated here. It is certainly a privilege to be here today. It's a great day for the city of Columbus and Franklin County, but more importantly for people in crisis, for what's to come. Like so many others, the foundation was part of the early discussions and planning to understand how philanthropy could help propel action to address this pressing community need. Recognizing the importance of the community engagement that Jeff just talked about, the foundation prioritized early support to fund and support that planning process in the early days that resulted in the vision for the innovative services that the center will soon provide. With the vision and plan in place for how to best move forward, the foundation was pleased to lead the way for Columbus's generous corporate and private philanthropic sector to join the hospital systems, the state, the city, and the county in providing the necessary resources to make this facility a reality. Our collective funding illustrates the importance of public and private investment in addressing community needs. The foundation is proud of Erica Clark Jones and the Adam Board for their unwavering leadership and commitment to reimagining how crisis services are delivered in Franklin County. The mission of the Osteopathic Heritage Foundation is to improve the health and quality of life in the community through education, research, and service consistent with our osteopathic heritage. Our approach to grant making aligns with osteopathic medicine's whole person approach to patient care and service in the community. And we recognize that the health and well-being of communities, families, and individuals are influenced by a host of conditions, including access to crisis services. With a welcoming environment, 24-hour services to care, innovative models of patient and family care, and connections to other community service providers, this center will honor and care for the whole person with dignity and respect. In closing, I'd like to take a few moments to acknowledge individuals with the foundation that are with us today. Foundation Director Dr. Becky DeVillers, our Director of Programs, Megan Wanzik, Program Officer Cheryl Graffinino, and Cindy Abden, our Executive Coordinator. We really view this as a mission moment for us, and it's an opportunity for us to see how our investments in the community are really making a difference. So thank you all for being here. The foundation looks forward to the much needed care and services that this center will provide and the impact that it will have on the health and well-being of community residents. So thank you again for the opportunity to be here today. Now I'd like to welcome to the podium Greg Crathaford, Marketing Coordinator for the Peer Center. Gary? Is it Gary or Greg? It's not Greg, it's Gary. I stand corrected.
That's all right. Well, first of all, I'd like to thank everyone for being here. My name is Gary, and I'm a person with lived experience. Like many of my other colleagues and the people that walk through the doors of the Peer Center, we seek hope. We seek something that is a solution to something that we don't know. It could be whatever's going on into our heads at that very moment. What does crisis look like, I ask you? Crisis could be anything. According to Maslow's hierarchy of needs, it could be anything from having a roof over your head. How about medicine? Having access to quality care. For the first time, I'm actually seeing a community come together and not just seeing a dollar sign, but seeing a person as an individual to seek care, to seek a better quality of life. And to be surrounded by such community members is an honor. And it is truly an inspiration to those that have, challenges and that seek the help that they so desire. So with that, my role at the Peer Center basically is meeting people where they're at that given moment. That could be whether they need a job, whether they need just somebody to talk to. One of the key elements of the center is that peers are there from the very start that a person enters that door until they leave. Another key element is that there's resources afterwards. We're no longer just passed around like cattle. We're actually sitting there with somebody that's seeing us all the way through the process as we continue to grow and develop. So with that, I'd like to introduce Jonathan Thomas, CEO of the Adam Board.
Good afternoon, everyone. Thank you, Gary. I recognize at this moment I'm the only thing standing between everybody and actually digging dirt to start this groundbreaking ceremony, so I will be brief. The speakers before me have represented many of the key partners that have made this moment possible, ranging from our board to state, county, city leaders. Individuals with lived experiences are at the core of our planning because we know ultimately this project has to meet their needs. Just as this crisis care center is going to be the part of a continuum of services, I'm up here just as a part of a much broader, more dynamic team. So I'm going to use some of my time to recognize some of my colleagues that are making this a reality. I'm going to ask that 6 of my colleagues stand up. I'm going to do a brief introduction, and then I would like for all of us to recognize them in this moment. Will Randy Duncan, Monica Wengler, Vince Sabino, Dwight Young, Mark Hunter, and Meg Griffin please stand up? And many of you know each other, but for everyone's benefit. So Randy represents Corner-Kokosing and Elford Strategic Partnership, and they're going to be leading the construction activities that'll happen right where we're sitting and standing in the next few weeks. And they're also integral in ensuring that that construction work is delivered, surpassing our aspirational goal of more than 18% of the work being awarded to local and minority businesses. Monica represents NBBJ, who's leading our design team, and they're instrumental in ensuring that all these guiding principles and visions we have for the center become a reality in every aspect of the building, both inside and out. Vince is our local lead with RI International, who've been bringing expert consultation to us from a design and operations standpoint. Dwight is our owner's representative from Hammis Company Healthcare, who along with Mark from Franklin County Public Facilities Management are bringing expertise in construction to this project. I often say with my colleagues, AdamH does a lot of things. Building buildings typically isn't one of them. So that expertise has been invaluable to us. And then last and certainly not least is AdamH's Senior Director of Provider Relations, Meg Griffin, who I can say with confidence, this building would not be what it is and will not become what it's going to without her commitment to the vision for the Crisis Care Center. Our team has remained committed through this entire process and guided by the understanding that we have a responsibility to the individuals who are in need of these services in order to realize AdamH's vision where everyone has equitable access to quality care. So I want to end with saying that at the center of the planning and design for the Crisis Care Center is the hope that we're going to help some of our most vulnerable individuals in our community find a stigma-free path to mental health and wellness. This concludes the formal acknowledgement speaking portion of our program today. We will now be moving outside for the official groundbreaking of the Franklin County Crisis Care Center. We will be exiting through the door that's being opened to my left. And I'm going to ask that all of our speakers today, as well as our county commissioners in attendance, join that first photo, and then we will have staff that will be arranging additional shots from there. Thank you all very much for your time today.
Oh, yeah. Oh, wait. We got to get more people. We go. Okay, you got it. All righty. Good? Got it. 3, 2, 1, dig. All right.